Hi there everyone. Today I'm going to do a quick 20 minutes release work with a tennis ball. You can use anything similar, whether it be a racquetball, lacrosse ball, spiky ball. Make sure that you're on a carpet or a nice big padded mat so that it doesn't cause you too much pain. And what we're after with this is a bit of myofascial release, working into those tighter trigger points. And they can be muscle, they can be fascia. And if you can imagine the fascia a bit like cling film, where it's wrapping around every part of your body, connective tissue between tendons and muscles and bones and joints, and especially within anything that has gone through any sort of trauma, stretch, tear, a scar, anything like that. So I'm going to work from the bottom up, but really focusing around pelvis, tummy muscles, into your SI joints, and even a little bit more pelvic floor stuff as well. I think what I'm finding recently is that a lot of people want and think that just strengthening exercises are going to be the answer to pain or to rebuild their foundation, when actually you need to release first. You need to get a good grounding and a good foundation, a good starting point, before you then build up the collagen fibers to strengthen. If you are strengthening into an already tightened position, a shortened position, then it's only going to get tighter. Okay, so if you think about that in terms of a pelvic floor that is maybe overactive, if you keep doing Kegels and you're just contracting it more and more and more, it's then just going to get even more tight. Same with abdominal muscles. I think what we're finding within diastasis, where there is a separation but then it's a bit stuck out there, if you're just strengthening and strengthening, that's never going to come back. You've got to release first and get the length back in the tissues before you then start to contract it. Let's get on, stop my yabbling, starting at the bottom, okay? We're going to put it under one foot, and this is more for a bit of down training again, and just do some nice little circles. Think of it actually as a bit more of a triangle, right? Down to your heel, up towards pinky, across to big toe, and down to heel again, so that you're crossing both the medial and the longitudinal arch of your foot. And you can press as deep as you want, but like I say, this is a little bit more of down training. So take a nice deep breath here. It's trying to relax that nervous system a little bit, and it's just getting your attention to just one point, feeling that nice tactile touch. And this is why massage is so great. And I really feel for all those new mums and old mums that are just yearning for a nice relaxing massage. So hopefully the salons will be opening soon. And if you find a little point, and it's usually right into the middle, in line with big toe and heel, where you get a nice thickening of your plantar fascia. And again, we're talking into your primary sling. I know I've mentioned that a few times. A sling of connective tissue that attaches all the way from your feet into your pelvic floor, up into your abdominals and up into your jaw. So if you find a tender spot, what I want you to do is just lay on it. If you can bear it, we're looking for a 6 out of 10 discomfort, but it's bearable, okay? It's not a pain, but it's a pain that you think, actually, is it a good pain? Good. And with all of these, you're going to find points that are different from everybody else. So just work around, have a little search, and if you find something, breathe into it. Let's switch the feet over. And again, on one side is always going to be slightly tighter due to just our asymmetry in doing things. We should be quite symmetrical beings, but we're not. Everyone is dominant on one side. You're going to be carrying baby on one side, reaching and lifting, carrying on one side, or from previous injury or occupation, sport. You might be very dominant and stronger and therefore tighter, or weaker relatively. So again, down to the heel, up to the pinky, across, down to the heel. 3 nice big breaths here. Find any little points there, just press into them, and then relax the toes and the knees, soften through the belly, and just stay there for an extra little breath. Just wiggle your way around it, and then settle yourself back in. The body gets used to it. Release, and once more. It's just taking that 5 minutes just to focus on one little thing, ease the mind, ease the tensions and the stresses around your body. Coming a little bit further up the chain into your calf. So right in the middle, nice big juicy calf muscle where your Achilles actually attaches. And you can start just with a single leg, and you might find that, yeah, off to one side there's a few little tender spots. So I'll gently roll up and down. I'm taking quite a bit of weight with my arms so that I'm just getting a little lift off your bottom so that you can get a bit more of a roll. Play around with it. You've got big calf muscles there, inside or outside muscle, usually a little bit, there's usually a difference. Again, settling back into a point that is a little bit uncomfortable. And if you want to add a little bit more tension, then let's add the opposite leg over the top. 6 out of 10. Okay, so you might find that you're fighting it to begin with. Take a deep breath. Make sure that ankle releases, quad releases. Okay. And it might take a good few breaths just for the body to settle in and think, yeah, I can bear that. If it doesn't, ease off. Go back to just a bit of lesser weight, lesser pressure. Take the pressure off, move around, find another little spot. Relaxing into it. And another good one that we'll do as we move up the chain is finding a spot, but then you're actually going to mobilize that muscle. So if I focus on this calf here, I'm then going to draw my toes up towards me. I feel that more because then I'm stretching through the muscle at the same time as trigger pointing it, and release. Stretch, bring your toes up towards you, keep the pressure on the ball, and release. Move into a different point, stretching it, and release. To a degree, we're talking this no pain, no gain. Switch over. Let's see if there's any difference on the other side. Just having a little feel through the inner side. Gently rotate the hip outwards. Definitely my outer one a little bit tighter. And then find a point to relax into. Let the ankle go, let the quad go. And then I'm going to add an extra pressure on the top. Good. Okay, and some people are just prone to tight muscles in different areas. Sometimes it is just the way that your body is made up, but it's often more so to do with your function or your activity. Okay, then mobilizing it through a different way, stretching through that muscle, release. So if you're finding little areas that you feel like you want to work a little bit harder on, then just come back to it after. Okay, we don't want to cause any bruising, but for some people, especially new mums that are perhaps slightly anemic, please be aware that you're not causing a lot of bruising. We're going to go up the chain, okay, into buttocks, and then we'll switch over to hip flexors. So we'll look into piriformis first, okay? This is your big muscle that helps to rotate your leg outwards. So even if you just sit cross-legged to begin with, feet together, lift up through your back and drop your knees out. Feel, where is the tension there? Is it in your inner thighs? Is it round the back? Is it into your lower back? Can we do a few pelvic tilts here just to loosen up through the lower back? Just to get an awareness of where that tension is. Okay, so now we're going to stay in this position and put the ball into what I would call your center of your bottom cheek. Okay, find your sit bone, so that's the bone there. You're then going to come off towards your hip and maybe up an inch. But again, play around with it, okay? So I'm leaning into it a little bit there, but I'm not sitting on top of it, okay? Taking the weight a little bit with the hands, and then start moving buttock around, just circling through your pelvis, and perhaps again you're going to land on a little point that is just not too comfortable. Again, I'm not sitting on it, I'm more so leaning on it. Pressing through with the heels as well as the hands. Let's rest into it. And again. And rest into it. Now you can make these pauses a lot longer. We're talking minutes, but I'm just doing it for a few seconds. And then again, mobilizing into it. So leaning into it, but now opening up that hip, getting a bit more of a pressure through there. So I'm using the exhale more for that relaxation point. And again, coming forward slightly. Play around with it, find that point. Now I've just hit a sciatic nerve right there and it's shot all the way down to my ankle. Now that's not a bad thing. It shows that my nerve is a little bit sensitive and I've probably got a little bit of tightness around there. That can happen in someone that doesn't have any sensitivity. You're just trigger pointing around the nerve, it becomes quite superficial in your buttock. But I know that my left side is definitely tighter than my right, and always flares up after I've been running along with my kid on their bike. So leaning over, usually compressing down on that left side, trying to teach them how to ride a bike. It's been taking months. So this left side is always tighter. I can always find little points there. So just roll into it, find it, and then mobilize into it a little bit more. If you do feel any nerve shooting or tingling, don't worry about it. Just ease off and hopefully it'll go away. Okay, the next one here, again staying on this left side, put it just slightly deeper. Okay, not on bone, make sure it's not on bone, it's still on a nice juicy bit. And you're just going to flex in and out with the knee. So again, coming up here, we are stretching the muscle, and here we're putting more pressure into it. Move around, find a spot. Okay, and whichever one you feel more comfortable, coming out the way or coming forward, okay? What I should say is the one that you find more discomfort. So the one that you're finding is more effective. Okay, same here. A little lift over onto the bum cheek. Get it in, up from the bone, towards the hip slightly. Okay, leaning on it, but not sitting directly on it. Lifting up through the heels, and just go for a few little circles. How does this side feel? Is this the side that you're holding baby on all the time? Are you compressing through that side? Lean into it. Relaxing. I feel my quad spasming a little bit. It wants to kick in, it wants to help. I'm trying to let it go. And again, a few little circles. And then just landing on a point. Breathe into it. 6 out of 10. No more. Back off a little bit if it's just too sensitive. Okay, it takes a while just to play around with it, just to get used to how hard is this ball, where am I actually trying to feel any trigger points here. Again, find one. Let's rest into it and let the knee gently flop out and in. And it's really bringing your awareness into your own body. We just forget about the stresses and strains that it's going through, and actually being able to find the spots without them telling you about it just shows that you're caring. Another 2 here. Good, heavy leg, just breathing into it. Okay, a little bit deeper to bringing the knee in and out. Okay, and for some, if you're not finding any points, then that's okay. Always worth looking, but if you're happy and you feel it more elsewhere, then focus on those points. Good. Okay, let's stretch into hip flexors, which first of all, I'm going to completely change the way I used to do this. So often in my classes, you'll see me doing this and I'll say, let this leg go, okay? And instead of working into the hip, I'm actually extending through my spine. If we can stay in a position where our knee is directly underneath our hip, this is stretching into our iliacus a lot more than this is here, okay? So keeping 90 degrees through knees and through hips, and then if you're not feeling too much through here, just activate through this glute a little bit more, and that's gently going to squeeze in through the glute, gently tilt the pelvis back, and hopefully you feel a little bit more through this hip flexor. The more tight you make the opposite muscle, the more length you're getting in the opposite muscle. Okay, same as bicep, tricep. Okay, I'm only going to work my tricep fully if I can fully extend and stretch through my biceps. So it's exactly the same as glute and the hip flexor here. And even just staying like this, you're challenging your balance, a little bit of core stability, but you're getting quite a nice pull through there. So let's focus on this one side, the back leg. So this is quite a strong one, where a tennis ball might just be too hard, okay? So I want you to find belly button. You're going straight down from there. You're going to land on your pubic bone, so the bony bit of your center of your pelvis, and then across from there, I want you to find your hip flexor, which might actually then turn into a little bit more into your inner thigh, okay? But we'll see where we get to. And again, you're just trying to find any tight spots, okay? So that's where the ball's going to go. As you come down onto your front, and use your arms as much as you want to try and take the weight off, okay? So right now I'm not really putting any pressure into the ball. And then I'm going to let my shoulders go, which then lets my hips go, which then lets my belly go. And I want you to just hone in and body scan down from the top, shoulders down, big inhale through the ribs, let the belly go, sink your hips, sink your knees, relax your ankles and your feet. Can we take a step forward with our hands? If it's too much, back off again, bring your hands closer towards you. If you feel, no, I can go a little bit further, am I putting enough weight through the ball? Let's come down onto our forearms. So we're offsetting the pelvis because we've got a ball under there. So you might feel like you're leaning more towards the opposite side. Let's see if we can keep that pressure through the ball side. And then we're going to try and bring our body up towards your hands. So as if you're pulling your hands back towards you and then release. Pull and release. Now I'm not getting a huge amount of movement here. Much easier if you've got a roller. But you're coming forward and back. Breathing out, using that as a relaxation rather than a tensioning. Okay, and then last one here, getting a little bit more movement. Relax the belly, relax the pelvis. Can we extend that leg? Okay, so again we are stretching through the front of the hip. And getting a little bit more length through that front muscle. And again, a little clench through the buttock and release. Let's stay on this side, as then we come up more into your abdominals. Now imagine again this center line, belly button. You're coming off, imagine that you've got this nice six-pack muscle down one side, and it's on the edge of that as it attaches into your obliques. That's where we're going, okay? So I'm in line with my tummy button, but off a good 2 inches, okay? And I'm then going to pop it down there. Again, play around with this one, because if you've got a large diastasis or a C-section scar, you might want to go closer to that area. Sinking your belly down, extending through your upper back a little bit more. And then same here, can we lift a leg? And one more. I'm going to go slightly further down. I know that that's where my tension lies. And I'm gripping more with my lower abdominals than my uppers. So my lowers are a lot tighter. So I need to release them to get them working a little bit more efficiently. So that's a tighter area for me. I'm just going to try and sink down into it. And then again, 3 little leg lifts, which is encouraging you to push more with the belly, engage the glutes, and again lengthening through hip flexor and abdominals. Okay, but be careful with this front area, especially if you're early and postnatal. I wouldn't recommend it until about 6 weeks, so that everything is shrunk down. And if you've just had a big meal, or I mean, this can help with constipation and digestion, but let's not aggravate things. Okay, over to the other side. So I'm going into hip flexor first. So just off pubic bone, into the groin a little bit. Okay, again, lots of ligaments and nerves here. Again, for me, quite a bit tighter here on the left side. Relax the pelvis so that you're not drifting off to one side. Nice deep breaths just for the body to get used to that. I should have started up here, sorry. Taking that pressure off a little bit more. Going forward with the hands, sinking in a little bit deeper. Stay here if you're at your 6 out of 10 already. Feel if you can go that bit further, come down onto forearms. Have a little rejig if you need, making sure that you're not on your bone, you are on a soft bit. Pulling yourself forward and back. the bottom and then release. Okay, it's only going to release if you give it the chance, give it the permission to let go. If you are fighting it because it is too sore, it's never going to let go. So breathe into it, find a more comfortable position where you're maybe only putting 20% through rather than up to this 70, 80. And release on that side, and then go into your tummy a little bit more. So off of the belly button, 2 inches off to the side, finding that connection point between your obliques and your rectus. Okay, how does that feel? Can you let it go down another little bit more? Finding a point there that you're sinking into. Let your belly drop. Hopefully you're feeling that gentle stretch and pulling through the tissues. And rather than just your skin massage or even into your scars a little bit, with the ball you're definitely feeling like it's hitting a lot deeper. Big breath here. And then again, let's go with 3 little leg lifts. And gently come back up. And we can stretch through the abdominals with a nice cobra. And then I just want you to do the other hip flexor. 90 degree, 90 degree. Getting your balance first of all. And then gently tucking in that back glute. And you feel that down the front of your thigh, hopefully. Nice long spine, because if you start bending forwards, then you're taking the pressure off there again. So especially if you've been sitting a lot, you've developed a lot of rounding, curved postures, bottoms tucked in a lot. Let's stretch out hip flexor a little bit more. Huge muscle. Really big driver for any pelvic and back pain, so keep the nice length in it as much as you can. Okay, back onto your bottom. Okay, we'll go down onto our backs. And now we're going to do our side glutes. Okay, this is quite a common one if you get any lateral thigh pain or ITB pain, where a lot of old school physios will tell you to foam roll here. But that is not elastic. That is a nice, really tight connective tissue there. It's supposed to be there because it's supporting your knee. If that is loaded too much, the problem usually is that up here you are weak or tight or both. So let's work into your side glute a little bit here, which is your clam exercise. So we're going to lie on our back first, rolling over to one side, find your hip bone, okay, nice big knobbly bit at the top of the thigh, and between that and your pelvic bone up here, you're going to find a nice medium point there, middle ground, okay. You're then going to roll over, again make sure you're not on bone, roll over onto it. It's a sore one, okay. Palms down, use that pressure to try and take it off, okay. You might have to go through a sorer point to get your knees right over. Breathe. Okay, this is not nice. We're looking at that definite 6, 7 out of 10. But can we stay here? Relax the toes, the ankles. Let the knees hit together. Now just imagine that point that's sitting on the ball. Let it give. Let it lengthen. pelvic floor? Is it open? Is it relaxed? Tummy, chest, ribs, shoulders. If you're not hitting it, come back over, adjust your position. It's a strong one. And only then did my bottom leg hamstring give a little bit there. So really focus in on calf and quad and hamstring, sinking, melting, releasing, using that breath as much as you can. Last breath. Dig your top foot down to then lift your pelvis up off it. Okay, give that leg a wee hug. And then we'll go over to the other side. Hip bone, pelvis in between, and then more towards your sacrum. You're then rolling over onto it. Okay, a little bit of bone there, so I'm going to come up slightly. And then again, maybe I'm going to lift this time to roll all the way over. You could just see it there. Again, definitely my left side is so much tighter. My bottom leg does not want to relax here at all. Let the toes go. The ankles, so the calves give. That's better. Thighs, hamstrings. Focus on where your ball's sitting. Let it give. If it's too sore, back off. Try again. Okay, and you might only last for 3 breaths and then come off again. And you're just teasing the body and it starts to get used to it. And then again, higher up the shape, let the belly go, let the ribs go, shoulders. Imagine that tight cling film of connective tissue, and when it sticks to each other, it's just so hard to get it off. But that's what we're trying to do, is just peel one bit at a time, encourage the blood flow to the area so that lubricates it a little bit more. Good pain only. One more big breath. Bring the top leg up, dig the foot in, and then lift pelvis up. Okay, going back to your abdominals, you can use the ball or you can use your fingers. I'm going to use my fingers. Okay, imagine where your C-section scar is, or if it literally is here. Okay, you're going to start in the middle, and you're going from side to side. Okay, so from the left to the right. And we're starting to poke around bladder as well, so don't worry if that gives you the sensation that you need to pee. Okay, I'm not going skin deep, I'm going much deeper. Okay, so I'm not rubbing cream in, I'm poking quite a bit deeper, so that if you're doing that on your hands, you can really feel your tendons underneath. Okay, so digging in back and forth. Is one way or the other a bit tighter? And if so, then that's what you're going to focus on. If it feels the same, then just gently back and forth. Over to the left side, imagine splitting your scar. Imagine splitting your scar, whether you have one or not, into 3, midsection. Let's go over to the left third and do the same. And this is where your rectus comes down and attaches to. So often there's some nice big trigger points there. If you feel any, you're going to hold it. Breathe and dig a little bit deeper. And then again, work into it there. Over to the right third. Back and forth. You might feel that tight tendon of your rectus. Back and forth, feeling any tight bits. Let's breathe into it, dig a bit deeper. And work into it there again. If that is a tight spot for you, then just stay there. Or come back to it after. I'm going to go back to the middle and come an inch higher. So I'm just below belly button. And I'm going to come off to the left side again and rolling back and forth. We'll make sure your back is relaxed. Don't worry about this neutral spine. We want our belly muscles to be as soft as we can. Any little points, go a bit deeper. And then working into that a little bit. Now what I'm finding here on my left side, which is quite common, is if you find a little trigger point, I'm pressing on it, and that is just sending a message all the way around my back, exactly the same spot into the side of my left spine. Again, just showing you how much everything is connected, and that's that deeper transverse ligament, muscle and connective tissue. And working into it a little bit more. It's okay to feel that radiation of pain. It's just showing you that there's a tight spot there that is then sending a message all the way around the back. Let's try the right side. Release the belly nice and soft. Any little points. Let's go a bit deeper. And you can work that all the way up if you're feeling like you've got tighter bits right underneath your ribs as well, which can really contribute to any stuck diaphragm. If you're finding any issues with your breath or pain underneath your ribs, just do the same. Have a little feel around, really digging in quite deep. Any little tight bits, hold it. Take a deep breath. Sink your fingers just a tad bit deeper. Just a nice bit of self-massage all the way around abdominal wall. If there's any particular bit that you find tender or stuck, let's go back to that. So I'm going to come into that midsection on my left. And the next time I'm releasing, going a little bit deeper, I'm going to slide my leg away, trying to keep my abdominals nice and soft. Inhale, bring it in. Exhaling, stretching away. If you still want to get a deeper sensation, you're going to pull your abdominals up as you lengthen the leg away. So I'm digging in, I'm anchoring my fingers, a bit of a scoop, and then I'm going to pull it up because I've got a lot of loose skin, so it does help to draw up that connective tissue as well. Drawing it up as I lengthen the leg away and getting that nice pull all the way down into my hip as well. And a breath here to release. So lots of work that you can do around your abdominals there, okay? Into your lower back, okay? Ideally, this is better if you have two balls, okay? You can put them either side. So I want you to imagine your pelvis around the back and my thumb being on the little dimples around your SI joint. Okay, so again, avoiding directly onto your bone. You're going to come up into that lumbar fascia. So feel for those little bony bits around the back and then say an inch or two up from that, but definitely off to one side. You're not on the spine. So dimply bits, an inch or two up, and then potentially a little bit further outwards. Pop your bottom down and relax into that. Let's try a few little tilts here. So come off the ball and then squash down again. And off and squash down. Again, you might feel that radiating round or downwards. Adding one other element here, you're going to float your arms. So release off the ball, and then as you squash down, let's take the arms overhead, lengthening through the spine. Inhale off. Exhale, squash it down. Play around with different areas here. I'm going to move up just another inch because you can maybe see that that's my more mobile bit of my lower back, but just another inch upwards, staying about an inch or two away from the spine laterally. I'm going to do the same here. Now that's a lot tighter. So I'm probably up at L2 if that makes any sense. Hold it there if you can. Breathing in again and out. Are you starting to grip with your toes or your calves or your quads? Let the legs go. Good, okay, really quite a tight bit there, so no more than that 6 out of 10. And release. Let's try the other side. Just above the dimples, off to one side slightly. Starting to just settle into it first if it's comfortable, then start doing your pelvic tilts. I'm going to go up just another inch. Again, probably find that this is the same point that was getting triggered when I was hitting my tummy muscles. And adding that tilt and overarm stretch again. So what's happening at the ball is that you're putting pressure onto one point. At the same time, when you're tilting, you are lengthening the lower back and then getting even more of a fascial stretch as I elongate the spine. And then holding that last one, release the arms, the toes, the calves, the ribs, the shoulders. Play around with it. Okay, now that you get the idea, you're finding these spots on yourself. I'm giving you a little idea of where they might be. So starting with your lower legs just to release it, then coming up more into your piriformis, your center of your glute, off to the side of your glute, into your hip flexors, your abdominals, and then into your lumbar spine. And holding each one if you can for a good 30 seconds, if not more. Adding a little bit of movement and always releasing into it. Make sure that you're not pressing and breath holding because that's only triggering other areas of tension. And then in this position, let's take the ball out, soles of your feet together, and let your knees drop open. So now that I feel like hips are good, tummy's good, back's good, my inner thighs are now telling me I need to stretch them a little bit. Now, if you were able to do a little 10 minutes of this a few times a week, you then complement it by doing some strengthening exercises on top and always being aware of how you're moving, how you're lifting, and how you're just doing your day-to-day functional tasks. Are you always compressing down on this left side? Is it always your leading leg in and out of the car, up the stairs? But more often than not, it's this heavy car seat on one side. It's holding the baby. It's sitting cross-legged at a desk. Okay, nobody is symmetrical, but we can ease into that and release, and then strengthen up so that we come a little bit more balanced. Good. Gently ease the knees together, and then give the knees a nice big hug and a roll into your lower back. And release off. And that is just a nice little taster of myofascial release and a bit of trigger point with a tennis ball. Equally, you can use a foam roller, or even just going through the stretches, motions, and with your fingers. You don't have to use something that's maybe just a little bit too strong for you at this point. So thank you for watching, and I will aim to stick up another couple of more strengthening exercises that are going to follow that. Have a nice day.